Cancers of the mouth and throat, or as we call it, head and neck cancers, are one of the commonest cancers in India. I'm sure you would know somebody who has unfortunately had this cancer, partly because of tobacco and chewing tobacco and smoking tobacco. So it's a very common problem in India. It's also a cancer which needs a lot of intense treatment, sometimes in the form of surgery, radiation, chemotherapy, and oftentimes a combination of all these three. And that leads to the side effects that the patients may experience, and that is where equipment like ETHOS comes in. Around 70% of the patients of head and neck cancers will need radiotherapy at some point in their journey. And ETHOS Radiotherapy is the most precise way of delivering that treatment. ETHOS Radiotherapy at Sir H.N. Reliance Foundation Hospital is a completely AI or artificial intelligence based machine. The beauty of this machine is that when we do the radiation for the patient, first step is radiation planning. That entire planning process is done with the help of artificial intelligence, which is able to detect what is the best way to deliver this treatment, where we give maximum dose to the tumor and the minimum dose to surrounding structures. And these surrounding structures in the head and neck area are very sensitive. They are your salivary glands, as we call it, parotid glands, your spinal cord, your brain, brainstem, and so many of them. So with the artificial intelligence, we are able to reduce the dose to the surrounding structures significantly and focus mainly on the tumor. So planning process of ETHOS is the key to reducing the toxicity of radiotherapy in patients receiving radiation for head and neck cancer. When it comes to treatment, ETHOS again is very comfortable for the patient. The way we have set up ETHOS is a very beautiful environment where the patient lies down very comfortably on the machine, looking at a beautiful scenery on the ceiling. The machine also itself is very comfortable. It's a large machine where the patient does not feel any claustrophobia. Now for head and neck cancer patients, we have to make the patients wear a mask so that they do not move while treatment, and that mask is from their head up to their chest. We are the only institution in India which is importing these specialized masks, which are open face masks, where the entire face of the patient is actually open. All other hospitals use closed face masks, which can cause a lot of discomfort and claustrophobia for the patients. We are so concerned about patient safety as well as patient comfort all the time. So when the patient lies down finally on the treatment machine and we are about to start the treatment, the important thing is to deliver this treatment precisely. You made a very good plan, but are you able to deliver it? ETHOS comes equipped with a very good CT scanner inbuilt into the machine. When the patient lies down for the treatment, we come out and we do a CT scan for the patient. That CT scan is then compared with the original radiation planning and we make sure that the treatment is then going precisely to the point which we want to treat. Also, ETHOS is much faster than all other radiation equipments. It's around 4 times faster than other machines, which means patients spend less time onto the machine in the mask, and hence we are able to take them out quickly, making this entire process not just precise but also very comfortable for the patients. So ETHOS radiotherapy for head and neck cancer is really the way to go forward. Now ETHOS also offers one big advantage of what we call as adaptive radiotherapy. Here what we are able to do is we are able to change the entire radiation process in a way that it adapts to that day's, or rather I would say that minute's, patient's internal anatomy. Sometimes patients lose a little bit of weight, sometimes there is a little bit of movement, sometimes there is internal motion of the organs. ETHOS adaptive radiotherapy is able to detect that because of the AI component in it, and then completely generate a new plan every day, every time the patient comes for treatment, generate a new plan and then deliver treatment with that plan. This is the absolute state-of-the-art radiotherapy which we can offer for head and neck cancer patients. The aim is, again, as I said, to kill maximum cancer cells and protect maximum normal structures. and hence achieving better quality of life and better control over the tumor. Please get in touch with us if you wish to know more about ETHOS Radiotherapy.